Sexually transmitted disease or STD or sexually transmitted infection STI are generally acquired by sexual contact with bacteria, viruses, or parasites that cause sexually transmitted disease may pass from person to person in blood, semen, or vaginal and other bodily fluids. Source of bumps of the genitals or in the oral or rectal area, painful or burning urination, discharge from the penis, usual or odorous vaginal discharge, unusual vaginal bleeding, pain during sex, sore, swollen lymph nodes, particularly in the groin, but sometimes more widespread, lower abdominal pain, fever, rash over the trunk, hands or feet. Signs and symptoms may appear a few days after exposure. However, it may take years before you have any notable problems, depending on the organism causing the STI. Causes: STD or STI can be caused by bacteria, gonorrhea, syphilis, and chlamydia are examples of STI that are caused by bacteria. Parasites. Trichomoniasis is an STI caused by a parasite. Viruses. STI caused by viruses include HPV, genital herpes, and HIV. Risk factor of having a sexually transmitted disease or STD. Anyone who is sexually active risks some degree of exposure to an STD or STI. Factors that may increase that risk include having unprotected sex, having sexual contact with multiple partners, having a history of STIs, being forced to engage in sexual activity, misuse of alcohol or use of recreational drugs, injecting drugs, being young, complication of STD or STI, because many people in early stage of an STD or STI experience no symptoms. Screening for STI is important to prevent complication. Possible complications include pelvic pain, pregnancy complication, eye inflammation, arthritis, pelvic inflammation disease, infertility, heart disease, certain cancers such as HPV, associated cervical and rectal cancer. Prevention of STD. There are several ways to avoid or reduce your risk of STD or STIs. Abstain. The most effective way to avoid STI is to not have sex with your partner and other men or women. Stay with one unaffected partner. Another reliable way of avoiding STI is to stay in a long-term relationship in which both people have sex only with each other and neither partner is infected. Wait and test. Avoid vaginal and anal intercourse with new partners until you have both been tested for STI. Get vaccinated. Getting vaccinated early before sexual exposure is also effective in preventing certain types of STD or STI. Use condom and dental dams consistently and correctly. Use a new latex condom or dental dam for each sex act, whether oral, vaginal, or anal. Don't drink alcohol. excessively or use drugs if you are under the influence. You are more likely to take sexual risks. Communicate. Before any serious sexual contact, communicate with partner about practicing safer sex. Consider male circumcision. For men, there is evidence that circumcision can help reduce the risk of acquiring HIV from women with HIV by as much as 60%. Consider using pre-exposure prophylaxis or PrEP. The Food and Drug Administration or FDA has approved the use of two combination drugs to reduce the risk of HIV infection in people who are at very high risk. How common is teenage pregnancy? Teenage pregnancy is pregnancy in women 19 years of age or younger. A woman can get pregnant if she has vaginal sex with a man at any age after she's begun having regular monthly periods. What are the signs of pregnancy? You'll probably first realize you are pregnant when you skip regular periods. But if you are a very late period, around the time you expect it, don't assume you're not pregnant. It's possible to have a very light bleeding in the first few weeks of pregnancy. Signs of pregnancy include mess of very light period, breast tenderness, nausea, often in the morning vomiting, feeling lightheaded, fainting, weight gain, feeling tired, swelling abdomen. How does teenage pregnancy affect teen mothers? Teens are at high risk for pregnancy-related high blood pressure and its complications than average age mothers. Risks for the baby include premature birth and low birth weight. Preeclampsia can also harm the kidneys or even the fatal for mother or baby. Pregnant teens also have a higher chance of becoming anemic. Anemia is a reduction in the number of red blood cells. This can make you feel weak and tired and affect your baby's development. Tips: use extrauterine device. An intrauterine device is a device a doctor implants in your uterus. The procedure is well tolerated and hospitalization isn't required. IUDs are sold under following brand names: Kyleena, Lilita, Mirena, Paragard, Skyla. Birth control implant. Several birth control methods affect hormone levels in your body, so you're less likely to get pregnant. The most effective is a birth control implant, also called Nexplanon. This is a very small plastic stick that inserted under the skin of your arm. Condoms. Proper use of condoms can keep you from getting pregnant. When used correctly, condoms also protect you from many sexually transmitted infections or diseases.